I'm Denise. I'll be your nurse today. What's your name?
Rosemary.
All right. And who do we have here, Rosemary?
This is my daughter, Daisy.
Hi, Daisy. Okay. What brings you in today?
I don't really know why I'm here.
Okay. All right. Can you kind of tell me what's been going on with you and anything different that you've noticed?
I guess I just haven't felt like myself. Everyone keeps telling me that I'm forgetting things and stuff like that.
Okay. All right. Rosemary, can you tell me your first, your last name, and your date of birth?
It's Rosemary Brown, and my date of birth is March 2nd, 1942.
Okay. All right. And so you're not really sure like what's been going on. Can you tell me where you are?
Yeah, I'm right here.
Okay. All right. Can you tell me what the date is today in the year?
It's November 11th, 2000.
Okay. And what have you been experiencing lately?
I don't know. I mean, everyone's telling me that I'm confused and that I forget things, but I'm just getting older and that happens.
Okay. All right. Any change in moods or feeling like you're mad or angry for any reason?
Well, my daughter recently moved me in with her and my grandchildren, and I keep having to clean up all these messes from them, and it makes me pretty upset sometimes, and I get frustrated and snippy, and they try to blame it on me, but I know it's the kids that I have to pick up after them.
Okay. All right. Have you been misplacing things, losing things that you normally don't?
I don't feel like I have. I mean, sometimes I'll forget where I set the laundry basket, but it happens to everyone. Anybody can forget.
Okay. All right. All right. What about socializing? Have you noticed any change in socializing? Have you wanted to avoid being around people?
No, I go to the senior center. I go there and I have lunch and I play bingo, and I come home and I have lunch, and
Okay. How often are we doing that?
I go to the senior center every day.
Okay. All right. Have you been experiencing any like memory loss that has like disrupted your life? Like if you're driving anywhere, have you noticed any change in finding where you are, like losing where you are, anything like that?
I don't think I have. I mean, there was this one time where I had to call someone to come pick me up, but
Oh wow. Okay. All right. And what about any problems with speaking or writing? Are you having a hard time writing anything or speaking with anyone?
no.
No? Okay. All right. All right, great. Well, do you have any questions for me?
No.
Okay. All right. Well, I'm going to go ahead and report our conversation to the doctor. Let him know what we talked about. All right. Well, thank you very much, Rosemary. It was a pleasure meeting
Thank you.
You as well,
Yep,
Daisy.
I'll follow you up.
Oh. Hi, Daisy. So, can you tell me like what's been going on with your mom and like how long this has been going on?
So about 3 to 5 months ago, we lost my father. So then we moved her back into the house with my kids and I. And ever since then, she started off, forgetting. She started simple tasks like cooking, and then she leaves the stove on, or she takes out, these crafts and knitting, and then she forgets she does it, and then she gets angry at my kids, like she said before, because she believes that they're making these messes and I'm not cleaning them up, and then she has to. And then when she said about the driving, she did go out for a drive, came back. She was in my subdivision, but she was on the wrong street, and she called me panicking.
Okay.
And that was just, a couple weeks ago. That's when we started getting really concerned. And then when she mentioned about socializing, with my father, she used to go to the senior center almost every day, play bingo, socialize. And now, she says she wants to go. I take her there. She's there about 3 to 5 minutes, calls me that she doesn't want to be there anymore. So
Okay.
she's not actually socially, she's withdrawn from like family members, friends,
Okay.
all of that.
All right. I'll definitely make it a point to tell the doctor all of this that you and I have discussed. Okay. Is there any other concerns that you have?
Nothing really. I have noticed, she has been getting really agitated and
Okay.
more sad, I would say, and there's nothing really that cheers her up.
Perfect. Okay. I will make a note of all of this and let the doctor know exactly what's been going on. All right. Great. Thank you so
Thank
much,
you.
Daisy. Hi, Dr. Smith.
Hey
I'm
there.
Denise. I'm the nurse taking care of Rosemary. This is my student nurse, Abby. After finding what's been going on with Rosemary, she does have some confusion.
Okay.
She thinks that it's the year 2000.
All right.
She does live with her daughter. She's been experiencing some agitation, some anger. She's been confused with day-to-day activities. She's thinking that she's going to the senior center daily, but she's not. So there's definitely some confusion. Her daughter reports to me, Daisy, that she's been getting lost when she drives. So there's definitely been some ongoing confusions with her. Okay.
All right. Well, in addition to her standard labs, let's draw up a B12 and a thyroid lab too. I know we're gonna try and get her into the MRI, but let's add the PET scan to that as well, so that we can try and get a tentative diagnosis going.
Okay. Perfect.
I'm gonna go head on in there and do my own assessment. Is there anything else you can?
No, I think we're good unless you have any other questions
Nope.
for me.
How about you, student
What
nurse?
does the PET scan look for?
So the PET scan is detecting amyloid proteins, which is scar tissue. When this scar tissue builds up, the neurons can't fire through it, so it causes a slowing of your thoughts and perceptions, and generally slows your nervous system down.
What about the MRI?
The MRI is to rule out bleeding. We want to make sure that she's not actively stroking right now. So if she was, then we'd have to do some different interventions, but I truly don't believe she is actively bleeding out right now. Anything else I can do for you? All right, I'm heading in. Knock, knock. Hello there. My name is Dr. Smith, and I've got some results back from your imaging and from your lab work. Can you tell me your name and your date of birth, please?
It's Rosemary Brown, March 2nd, 1942.
Awesome. Thank you so much, Rosemary. And do you know where you are?
Yeah, I'm right here.
Right here where?
In this room with my daughter and you.
Okay, perfect. And do you know today's date?
It's November 1st, 2000.
Perfect. So, I've got these results back for you. In addition to your standard labs, we also took your B12 and your thyroid. Both those were within normal range. We sent you down for that MRI to see if you were bleeding, if this is resulting from a stroke. There's no evidence of bleeds. We also had you in for that PET scan to see if there was any amyloid plaque buildup in your brain, and it is showing a little bit of buildup there. So what we typically use the PET scan for is to diagnose, is a tentative diagnosis of Alzheimer's. Amyloid plaque buildup can be indicative of slowing of cognitive skills. There's no definitive way to test for Alzheimer's while you're still with us. However, this is a pretty good indicator that there is something going on cognitively there. So I'm going to go ahead and continue doing some more assessment things. First things first, can you take this piece of paper for me, fold it up hamburger style with your left hand, and then set it on the ground. Left hand. Can you do that for me? Okay, perfect. Thank you so much. Can I see this? All right, next thing's next. Can you go ahead and draw a pair of, do you know what a pentagon is?
No.
Pentagon is a shape that's got 5 sides to it.
Okay.
So can you draw 2 5-sided shapes that interlock for me?
Okay.
Here's a pen for you. Piece of paper here. We can do that right on my clipboard here. Perfect. Thank you so much, Rosemary. There's also that. I'll show you guys. All right. So, I do want to tentatively diagnose you with Alzheimer's, especially after the results of this little mental exam that we just did. I'm going to send your nurse in. We got some medications for you. We're going to put you on an antidepressant to kind of work with some of the aggressive behaviors that I know that have been coming out. And we're also going to throw you on an anticholinergic to help deal with a little bit of the confusion. Cholinesterase is what we're going to throw you on there. Is there anything else I can do for you guys?
I don't know what he's saying. Why are we here?
I'm sorry, Mom.
Can we please just leave?
Soon enough, okay?
We're going to have some meds for you that'll help with the confusion a little bit, okay? All right.
Thank you.
No problem, guys.
Hi, I'm Abby. I'm your nurse. I'm going to be giving you some medications that doctor ordered for you. Can you just verify your name and date of birth for me?
Rosemary Brown, March 2nd, 1942.
Okay, so doctor went ahead and ordered you some Exelon. This is going to help with your memory and function. He ordered you 8 milligrams twice a day. So this is your evening medication now.
Okay.
And it is chewable.
Okay. Good.
Do you have any questions about that?
Yeah. So is this going to take my Alzheimer's away?
It's not. Unfortunately, there's no cure for Alzheimer's right now. But this is going to help maintain some of your memory and your physical functioning. So you'll still be able to live independently and kind of take care of yourself, okay?
Okay.
This next medication we have is Zoloft. Doctor's starting you off on a low dose to see how well you tolerate it. It's going to help with some of that sadness and aggression you said that you've been feeling.
Okay.
Okay?
What do I do with these?
They're chewable as well.
Are you sure?
Yes, ma'am.
Okay. No. Okay. So how will I know to take my pills if I can't remember?
Well, when you go home, we can send you home with maybe some pill boxes, some weekly pill boxes. We can have you set up some alarms to remind you when to take them throughout the day. We can also give you some written materials about your medications that you can hang on the fridge or give to your family members so they can help you remember when you go home as well.
Okay.
Okay?
All right.
And doctor's also setting you up with a consult for occupational therapy and social work. So they're going to help give you some more information to you and your daughter for when you go home so you can have techniques and more information about how to live with this at home, okay?
Okay.
You have any questions for me?
I don't think so. Thank you.
You're welcome, Rosemary.
Hello. My name is Anne-Marie. I'm the OT here. I'm going to be helping you with, fall prevention and kind of keeping you having that quality of the ADLs in your life. So what is your name?
I'm Daisy. I'm her daughter.
Daughter, and you are going to be primarily taking care of her,
She
looking after her?
Lives with me, yes.
Okay, and then hi, you must be Rosemary, right?
Yes, I am.
Can you tell me your name and date of birth?
Rosemary Brown, March 2nd, 1942.
Good, you are who you say you are. So I'm going to start off just talking about kind of like home safety, because your safety is our number one priority. Like removal of rugs in your hallway. If you want to start having, some night lights or lighted hallways, just in case, you get up in the middle of the night, we don't want you falling over. Also non-skid shoes when going out, preventing any falls. And then starting to talk about, you did say in your report that you often drive. Is that a daily thing? Is it, how much are you driving?
A lot.
You are driving a lot. So we might want to, take that back or have you drive with the passenger just so you're not getting lost and having those panics like you were talking about earlier.
Mm-hmm.
And then also balance training, especially with some of the medications you were giving. Once you get up, I don't want you, to start walking right away. I want you to get up, kind of have 2 or 3 seconds, and then, then start to move, just in case your balance is a little off. And then also using labels around the house. So, a label maker, you can get that anywhere. You want to label your medications, the stove, maybe where like your toothpaste, all that is. Do you think that would be beneficial for you?
I mean, I guess.
Yeah, so you can kind of just, so you can see it where you're not thinking you're forgetting it because you can see it right there, especially kitchen supplies, leaving, the stove on. And I also highly suggest, sticky notes, to put around the house, like in the report you said about the stove, put that dinner made at 5 or dinner started, just so if you look at that, you can see. And then I'm going to go over some cognitive training tasks that you can do with her, and you can do on your own, puzzles, crosswords, if like a little mathematic books, if that's something you'd be into to kind of just train your cognitive. I'm also going to show you one that I think is very beneficial. I'm going to have you take this and write down 5 things you need from the grocery store. And then you can do this with, anything. 5 of your favorite pets, 5 cat breeds, or 5 of your children, grandchildren's names, and then wait about an hour and see how much of that you remember. Okay, good. And then there's also, if you are driving, once you're done driving, you can draw a map from memory. So you can, try and draw the route that you just took. That'll help, cognitively challenge you and remember where you were. And then refine your hand-eye abilities. So maybe start off, knitting or crafting, crocheting, just to kind of build that hand-eye ability, all right? Is there any questions for me?
Do you have any questions, Mom?
I don't think so.
Okay, can you try and remember the 5 things you needed from the grocery store?
Eggs. I can't remember anything.
Okay, so I just want you to look back at this. So, milk, eggs, butter, and toiletries, toothpaste. You just remember the eggs. So what's this going to do is going to try and make you train your brain to remember more of those, okay? So really simple tasks that will just benefit you, okay? All right, so you have my number. If you need any questions, anything like that, just let me know.
Thank you.
You're welcome.
Hi, my name's Alicia. I'm the social worker here.
Nice to meet you. I'm
Hi,
Donald. I'm
Donald.
Daisy's husband.
Okay, and this is
Rosemary.
Rosemary. Nice to meet you. So I just wanted to come in today and talk to you guys about a few things. Are you going to be the one who's going to be primarily taking care of her, helping her out?
Well, it's my wife and I. She lives with us.
Okay, so she lives with you guys. Okay. So I just wanted to talk to you guys about caring for someone with this disease or potential disease. It can become really stressful at times. It can be difficult and hard on both of you. It's going to be hard for you as well adjusting to all these changes. But there is a thing called caregiver burnout that we like to talk about, give you some ideas, techniques to work through it, basically. Did you have any concerns?
Yeah,
taking care of her?
my wife and I both work full-time, at least 40 hours a week. Usually I'm upwards of 60. We have 3 kids, and we also have Rosemary, whom I'm very fond of. But I'm just worried that it's going to be a bit much. I'm wondering if there was anything we can do to kind of mitigate this stress.
Okay, so as far as stress for you guys, there's different things that we recommend. There's, meditation, breathing techniques, physical activity if you like to exercise, different things like that. But there's also respite care services. So this kind of gives you guys a little more time to focus on you. So they would come, they could either be in-home or they provide actual transportation services to like an adult center. So I know that you said previously you like to go to the senior center, right?
Mm-hmm.
So they would come, take her, do some activities with her throughout the day that gives you guys time to spend with your kids, your family, do the things that you need to do as well. They provide meal services, so they could come in-home, deliver meals.
We've had
I'd
some
like
issues
that.
with the stove. Yeah,
I'd
I'd
like
like that too.
So, okay, yeah, I can give you guys all of the information on these resources, and it will definitely help
I appreciate
you
it.
guys out.
Yeah, that sounds like an option we're going to consider
Okay,
for
did you
sure.
guys have any other questions? No? All right, well, it's very nice meeting you.
Nice to meet you too as well. Thank you so
Get in
much.
touch with me if you guys ever need anything, okay?
Okay, yeah, and I think you're going to leave your
Thanks.
information for us.
Yep, I
Appreciate
will
it.
leave you. Thank you.
Thank you.
Mhm.